IVF is a great scientific advancement. We have had about more than 5 million babies that have been born through IVF. However, there are a lot of still myths that are there in circulation around IVF. People tend to think that IVF is not a natural process. We understand the basic science behind the egg and the sperm fertilized in the fallopian tube. The embryo grows there for about 3 to 5 days, then reaches the womb of the uterus of the mother, where the implantation happens, and we say that that's the pregnancy that's happening. In IVF, the same thing that happens in the fallopian tube, scientists have actually tried to mimic it outside the body, and therefore, the only process that happens outside the body is that fertilization and the growth of the embryo outside the lab. And therefore, we need to understand that IVF is only acting as a surrogate for the fallopian tube in women in which it is not working. Of course, it's now expanded to many other indications, but the rest everything else happens inside our body, as babies born to spontaneously conception. People think IVF is an extremely painful procedure again. IVF, as we understand, is entailing 2 weeks of injections. Now that's something that we don't have a shortcut for so far. Maybe science will develop some medicines for it. But so far we don't, and therefore, we have to give the woman some injections so that we can get multiple eggs that need to be harvested. And that actually is the only painful part of the IVF of journey, because you need to take injections that are administered to us. Once these eggs are ready, then they are taken out from the body through a small procedure, which is known as the egg retrieval procedure. And it is done under either anesthesia or male sedation, so you don't really feel anything. And the next important step in an IVF is when the embryo implantation process, which is putting the embryo back into the mother's. Typically that without any anesthesia, because it's not the painful procedure. The another myth that we have around IVF is that it always results in multiple pregnancy. The chances are more than a natural conception, and that's because you tend to put back to what 3 embryos to try and increase the chance of pregnancy. The overall risk of having a multiple pregnancy O2 and so higher. So because everything in an idea of happens outside the body, if you put only one embryo back, which is a concept known as single embryo transfer, your chances of twins are actually. It's just that it's also offset by about a 10% decrease in the success rate, but it's very much controlled. You can freeze the extra embryos and keep doing single embryo transfers, but your chance of twins is very much minimized. People ask me that if I can conceive one baby through IVF, so I'd never be able to have children of my own naturally. It's quite the other way around, because a lot of patients we have seen who can conceive, but difficulty in the first attempt may even require an IVF for any condition ranging from unexplained infertility, endorses or PCOS, might actually conceive naturally the next time. Probably because there are some changes that the body undergoes post-pregnancy, probably because the stress or the social pressure that is there, and the woman is no longer there. Surprisingly, you actually see that a lot of women might actually conceive easier on the next time around than through an IVF. Fifth, again, there is a myth that are the abnormalities of the high risk of abnormalities or high risk of miscarriages happen in IVF. Again, we have very clear cut documented research. Now we have all the risk of miscarriage in an idea of conception is no higher than any other spontaneous conception for people who have been trying for innumerable number of years. 15, 20 years. IVF has come as a boon where it can actually help you get as high as a 60-70% chance in that particular cycle to get pregnant. Time is of biggest sense in IVF, because the woman's age is a very important criteria, and therefore make a decision and go ahead with it if you really have to, because IVF overall is a very safe science.